Snake bites are becoming an increasing concern across many parts of Nigeria, from farms and rural communities to residential estates in major cities. Just recently, in 500 Housing Estate Lokoja, a young father had his productive life taken. In Abuja, a young woman was bitten by a snake inside her own residence while she was asleep. Reports revealed that 2 snakes were later discovered in the house, and despite efforts to seek urgent medical attention, her condition worsened, heightening the dangers and urgency of snake bite emergencies. Her story shocked many Nigerians because it showed that snake bites are no longer limited to forests or farmlands. They can happen even in homes and urban areas. Across the country, similar experiences are shared. Farmers in rural communities have reported being bitten while working on their farms. Children playing around bushes have also encountered snakes. And in some communities, residents wake up to find snakes hiding in shoes, bathrooms, or inside homes, especially during rainy season when snakes seek dry shelter. Health experts warn that snake bite is a medical emergency that requires immediate attention. Delays in treatment, lack of awareness, or resilience or harmful traditional practices can worsen the situation and lead to serious complications. The good news, however, is that snake bites can be prevented. Simple actions such as clearing bushes around homes, wearing protective footwear outdoors, keeping surroundings clean, and being cautious in dark areas can significantly reduce the risks. Equally important is knowing what to do when the snake bite occurs. Remain calm, avoid cutting the wound, and quickly seek medical care at the nearest health facility. Snake bites can happen to anyone, anywhere, and at any time. But with the right knowledge, quick response, and proper treatment, lives can be saved because awareness is not just information. Awareness is protection.
Indeed, awareness is not just information. Awareness is protection. Snake bites, usually when they happen, we often consider it as a rare or even rural challenges. But the reality today is quite different as we continue to receive reports of snake bites in the farms, residential areas, and even in our cities. Sometimes they end up with dangerous consequences. According to experts, it is not only the snake bites that is actually the problem. The problem is how people kind of react to that snake bite when it happens. What they do and what they don't do actually determines what happened next. Welcome to Health Talk 360. I am Khadija Abubakar Isa. This program is proudly brought to you by the Nigerian Television Authority, Lokoja. Our aim is to create awareness and help you make informed decisions about your health and total well-being. This program is live, giving you the opportunity to interact with your doctor. You can send us questions through short medium service or to chat with us on our Facebook handle at NTA Lokoja. And the number you can use to reach us via text message, calls, to share with us your insights. Your comments and contributions is 09070245924. Thank you so much for joining us on the program, Health Talk 360. Let's take a quick break. We'll be back in just a moment. Thank you for being there.
For over a decade, we kept you informed, helping you make smarter health decisions with preventive education. We took a short break, not just to rest, but to recharge and bring you something bigger, bolder, and better, tailored to what your health deserves, with a new name and amplified mission. Get ready for a healthier you as we introduce to you Health Talk 360. Join us every week as we explore the latest health trends, debunk myths, and expert advice from childcare, nutritional, to mental health. We will cover it all because your health is our priority.
Tune into Health Talk 360 on NTA Lokoja and take control of your well-being every Tuesday at 5:30 to 6:30 p.m.
For over a decade, we kept you informed, helping you make smarter health decisions with preventive education. We took a short break, not just to rest, but to recharge and bring you something bigger, bolder, and better tailored to what your health deserves with a new name and amplified mission. Get ready for a healthier you as we introduce to you Health Talk 360. Join us every week as we explore the latest health trends, debunk myths, and expert advice from childcare, nutritional to mental health. We will cover it all because your health is our priority.
Tune into Health Talk 360 on NTA Lokoja and take control of your well-being every Tuesday at 5:30 to 6:30 p.m.
Thank you so much for joining us on the program Health Talk 360. This week we are going to be talking about snake bite awareness, and our focus is prevention, first response, and treatment. And with us in the studio is our most respected doctor, Dr. Adebayo Joseph. Let's have your quick introduction, Dr. Adebayo.
Thank you for having me. I'm Dr. Olonfemi Joseph Adebayo from Federal Teaching Hospital, Lokoja. Thank you.
It's always a pleasure to have you on set.
Thank you.
Because there is always no dull moment having you on the program Health Talk 360. Thank you so much for accepting to be with us again this week.
It's my pleasure.
So quickly, looking at what we have just viewed about the little things we have been able to gather about snake bite in our community. Let's start with the preamble. What is the present situation before we go in detail?
Snake bite is a severe neglected tropical disease, and the threat is very serious, in fact, more than what we are talking about. And it's not only place all over Nigeria. And last month I was on call. Within the time that I was called, we saw 3. I was in Makurdi for another time. In Benue State, we found in the 2 places we went to, they are also there. So, and the reporter was in some of the northern states. So that's how they think them, with very, very high mortality and morbidity and mortality. So it's a serious thing among them, but it's actually preventable, but grossly neglected in our society.
You said it's actually a serious thing. So how serious is snake bite that it should be considered as a public health concern?
Yeah, because even in Nigeria, when I said even from our small place alone, that is in Lokoja, I can't tell that within a week we saw 3.
Within a week?
We saw 3. And then imagine what it be in other local government in Lokoja. Then look at all over the nation. And I even told you, I even went to so it's a serious thing because the statistics we even have in Nigeria is far lower than what we are talking about. And the problem that ensued after it is even worse than what we read in the newspaper and the data, because we don't keep data.
We don't keep data.
So that's why if I can give you whatever they will tell you about 2,000 deaths in Nigeria annually, which is grossly incomparable with what we see on the field.
On the field, that's very true. So now that it has become a public health concern, we need to know how we can at least prevent ourselves, and it starts from knowing the problem. Where are these areas that we should always look out for, at least to prevent ourselves?
Yeah, first, when we talk about snake, we grossly divide them to poisonous and non-poisonous. There's some people arguing that it's almost every snake is poisonous. But we found that they are poisonous and not poisonous. And of those that are poisonous, there may not be envenomation when there is a bite, because often snake bite to prevent unprepared. Yes. So, but when the page is prepared, maybe you are farming, you are drawing something, it has the mechanism that it stimulates, it loads the gland with enough poison, so that as soon as the person bed, it makes sure the person is given adequate dose. That you sit under AC in town, me inside bush, I still come here to come and disturb me.
Yes.
So that you must get what you are looking for. So that's the plan. So that's the thing. So to play that's why the big people who are culprit are the farmers, the snake charmers, the children, the elderly ones, and those who walk bare feet. And also there is seasonal variation to it, because during dry season, there's no water, there's no one, and especially in a hot condition like that, they will leave their holes and be going around looking for prey and then to come out from the heat. And that's why you see, especially January, February, March, if you read dailies and some medical and journals, you will see that is almost everywhere.
Statistics is high.
Since December.
So now that you said there are two schools of thought, one says all of these animals, snakes, are venomous, have serious venoms, right? While others say no. Like I share the thought of that school of thought that says all snakes are dangerous, because even their sight, I don't like it. So what are these signs and symptoms that one can look at to know which one is venomous and which one is not?
Yeah, when we talk about venomous, we use it in the olden days. Medicine, we use whether their head, the angulation of the eyes, the sight of the eyes, the type of the fang, the number of fungi you are beating to differentiate them. But we now found that they are not enough to differentiate venomous from non-venomous. Because usually when one is bitten by a venomous snake, you may see about maybe just two fangs, one fang, or you may not see anything at all. That's a sign of poor prognosis. It's a poor prognosis index when you don't see anything. So it comes, they are not going to take it important. And when one is bitten by a venomous, you see this. You may see the person may be bleeding from that place. You may see the place may have pain, it may be swollen, and maybe may be reddish. You may even see the skin peeling, and that side. This is what we see. That this is like what may be venomous. But there are things that happen that people say they are snake and they are not snake. For example, it may be stick injury. For them to walk in the night, start running up and down, snake, snake. No, right? It's not snake.
It's not snake.
It can be a scorpion bite. It can be a rat. Rat can also bite people.
Yes, sure.
So there are things people come and you find that it's not snake. Yes. And like I said, somebody can also be bitten by a snake, but the snake just bite to defend. Maybe you are walking there and just step on it. Usually that snake you often will not have time to secrete, to load the gland, to give the person the appropriate to do. So usually these are the one people think they will tell, they go to Chama, they go to that this person is the one that is healing, curing it. It's not venomous. If it's venomous, you see the person will still come back to the hospital to be taken care of. Like the one we saw, now that's why they were already advanced when they came. Because they already gone to, they said the traditional rulers, traditional healers, and those
try
one,
their best.
And those don't collect, when they have already fed fat on them, they push them out and send them out to the hospital. So these are signs you see in the venomous, and depends on the type of snake. Because we divide them to 4 broad groups. We call the columbridae, which are hemotoxic. We have the elapid, that is elapid that are neurotoxic, and then we have the viperidae. That are cytotoxic. There's what we call sea snake. They call it in hydrophidae, that's sea snake. These ones usually live in the water, and they are the ones that attack, especially fishermen. And for some of them, when they want to buy, they come out and set up.
In the water?
Yes, they come out and put their head and give the person that. You see your house, JJ in town. You came inside the water to come and disturb us. So take what you are looking for. So that they are the ones that attack. And one of the reasons, the condition that can make snake bite, to call envenomation, especially when it's chasing a prey. So it's already loaded, maybe it's chasing a rat, and it's already chasing and has loaded the gland. And then the man now intruder now go, snake. You now say, okay, you are not the one I'm looking for. So since you would like to be an intruder, go and give the mark, take your own and leave me alone. So, or like I said earlier, maybe you are in a farm, snakes already sighted, the person afar off. So now start have the time to look. Yes. So these are the conditions where the coin can be by beaten. Some of the coin can be beaten by a venomous snake, and then the symptoms the person will see when they come to the hospital.
Okay. Just like the case of that young lady that lost her life as a result of snake bite in Abuja. We learned that the snakes, after the incident, 2 snakes were found in her room. So I don't know why this kind of dangerous creatures will choose to come and stay with humans.
Everybody is looking for a fine place to stay, man. So actually, snake can stay in a place for 1 year, 2 years. If nobody is doing it and he's getting his own feed, you stay there and you will not even know. But the truth is that they don't just come like that. Those conditions, if you leave your environment bushy, you are rear something like poultry. So, and then you have also, or you pick black, maybe pies, ties, all of them, gather them around the house. They hide there. So when they now have avenue to come to the place, especially you have some people with toilet broken, they come creeping on through the country. So actually they don't just come and stay and just come into the house like that. No. And if your place is bushy, when they finish taking their siesta in the afternoon, they come to the house. They are there to come and rest in the night. So that's how you may find that. If you look at where that all those areas, you will see clear, practical signs of what we are talking about. Why the snake is not be surprising to you that you are seeing snake in the person's house. I've seen a place that I found the snake climbing the house, the wall, and into the house, because some of them live in the roof of the house. So, and that's where they will mate. They will have their. So that's when we are talking about, when we come talking about preventing or clearing for them, you fleet even including your roof, because within the roof
they can be there hiding. Do you know that until I grew older, before I got to realize that true snakes can climb, walls, they can climb stairs. Initially, I thought they can't go below, above maybe a higher platform. I thought they could only operate on the floor. But in recent times, we are seeing different kind of stories. Climbing trees, okay, trees is okay, they do that. But fence, and then even steps, you see them climbing steps.
Yeah, there are tree snake. Their main abode is on the tree. And we have seen people that were beaten by tree snakes. Because just like we mentioned the other time, I've been sitting down. You are in duplex in town. You came down. You climbed to come and meet in my own estate here. So they are they stay on the tree, and that they eat fish from nectar. Some of them on the inside are coming there. So like I told you, there are some on their own main abodes in the sea, and some also that in the holes. And the area that we are talking about, that some of them in deep holes. So. And that's where those who go there and put hand, when they are looking for rat games, they put hand there. There are some of the people at the risk of being bitten by snake, because, like I explained, especially in Benue, they have seen that they were looking for maybe a rat. They put their hand into the hole. Yes, and the snake will now come and say, welcome, since you come for coming, next time you won't do this one again, and give the person a good bite.
Thank you so much, Dr. Adebayo, and thank you too for watching the program Health Hub 360. Why this conversation matters is because snake emergencies are something that is very, very crucial. Sometimes people carry the consequences of snake bite not because they went fast at taking action, but knowing the right action to take can actually determine either to leave or to go. So we're going to go onto the street already. Madam Smaila Sadiq went to the street to ask people on management, when it happens and you are there, what do you do? That was the question he posed. You watching the program, what do you do when it happens? Yes, we are not praying, but when it happens, what can you do? Let's have this together.
Snake bite can happen unexpectedly, especially during farming, rainy season, or around our homes. Let's speak to some residents and find out their level of awareness.
You can apply if you are not, well trained in that field. You can use onion. You grind onion immediately, cut the place that was bitten by a snake, and put the onion so that it can draw out the venom immediately.
You can render on not only snake alone. Even there is an accident on the road, you can convey that person to the hospital in time so that he will be gaining his recovery immediately.
If immediately maybe snake bite the person, you have to give he or she 1 or 2 attention to maybe tight the leg. So you now be looking for maybe to carry she or to hospital.
First of all, get something to tie the person's leg or the hand, wherever, so that the poison will not go around the body.
Those days, we used to have some herbal remedy like first aid that you can quickly render. But then, we still have some experience. If such thing happen, you can just get a razor blade, new razor blade. That point of that snake bite, you just mark it, so that those poison will be coming out in line with the blood. Instead of it to be flowing and go to the brain, it will be like coming out. Then maybe before you rush or you get a bitter cola nearby. Also, it's a remedy to snake bite, like a first aid. It's not a total cure.
You know, in all those olden days, our father, they have local herb. Like my own father then, they have local herb. Immediately snake bite anyone, they will bring the person to my father and he will mark the place, the blood will come out. He will rub the herb. That is the end of it. But today, civilization has taken all those things away from us. The only thing we believe in today, because another people has bring their own ideology and we have accepted them, is injection.
And that's I will take him to the hospital for treatment.
Welcome to Health Talk 360, where your health meets the bigger picture. Every week, we go beyond the symptoms and headlines to bring to you the complete features on the issues that matter to your well-being, from nutrition to mental health, maternal and child care to chronic diseases, fitness trends to breakthrough innovations. We cover it all with clarity, depth, and trusted experts. Our mission is simple: to give you practical knowledge, real solutions, and inspiring stories that help you live healthier, stronger, and smarter. It's not just a program, it is your complete guide to a better life. Your 360-degree view of health. Join us live every Tuesday on the Nigerian Television Authority, Lokoja, for Health Talk 360. Informative, engaging, and life-changing.
Thank you so much for rejoining us on the program Health Talk 360. We've been talking, our focus today is snake bite awareness, prevention, first response, and management. And from what we have gathered from the streets, it's obvious that lots of people know a little about, yes, they know about snake bite, but the management, I think that is where I have some question to ask the doctor. I guess you also have that similar question to ask the doctor. So in the next few minutes, our lines will be laid open for you to begin to call. The number is 09070245924. Let's take it again. 09070245924. You can as well share with us, send us your questions via our social media platform, particularly Facebook at NTA Lokoja. Thank you so much for being there. And thank you, Dr. Adebayo. So I want you to give a quick analysis of what we have just watched together.
Thank you. When there is any incidence of snake bite, the first thing you do there is you should be calm. Don't just rush there. We've seen people bitten by snake bite. The good Samaritan that came, that the snake now say, you are the fight. Since you come to the good Samaritan, take your own and leave us alone. So look around. So the day of one person being beaten, you will now see two persons being beaten. Yeah. So the first thing now, you look around. The snake usually will stay around there. And the person will, and then calm the person. And that's one of the things we call them, the 5 A's of managing of snake bite management. A's is anxiolytic. So the person usually will be anxious. It's normal. So it is so much you may give. We in the hospital will give the person small dance, but otherwise may not give you anything. If there is pain, but if it is in the bush, you look at the place before you help. When he says you can carry the place, you carry, but don't usually let the person to walk on that leg. Carry it like a log of food. Don't put tourniquet. Don't put incision. I saw Dr. Mahmoud Mohammed there that was telling that the patient should make incision. Don't suck it. We have seen patients who suck snake bite. The person who has snake bite survived. They want to do fido prayer after some days for the person that suck the thing. So don't suck the thing. Don't put incision. Like the one that we have, the man was bleeding because when they are putting the incision that they are trying to the thing will come out. No. So don't suck it. So bring the patient like that also, and don't put tourniquet. We've seen those who have tourniquet, they have to amputate the leg. Because the thing now, what you call arterial tourniquet, the blood is supposed to be going to supply the place. That's what they tied. So don't tie tourniquet. And if it is tied, when we get to the hospital, we don't usually just remove it. No, we remove it small, so that what has gathered there can go to the circulation jolly. But don't walk with it. If you walk with it, it will quickly go to the heart, and heart will pump it to all part of the body. Take it to dependent part, let the pacemaker be down, because before the thing moves to the top, come to the heart, it will take some longer time where you probably would have gotten the person to the hospital. The person may also need anti-tetanus. You give the person tetanus because snake, and then some may also use antibiotic because snake doesn't use maclin and doesn't use close-up. So therefore, you have to careful you use antibiotic. Then, because you now go to antivenom. It's not every time we use antivenom. No, that's when you come, we look at it, and we don't discharge it on at least minimum of 24-48 hours, because some the effects start coming around 24-48 hours. So then there are other things that can now be done for that person, but don't suck it. If it is cobra or spitting cobra, what to do that? Take the eye in that water and rinse very, very well. But even instead of doing that, we'll bring to this person to the hospital. So this hospital, they will do it appropriately for you. So when the person gets to the hospital, the management that will just commence in essence. So, but don't suck. Don't tie tonic. The one they are talking Jerusalem stone. You think no, they work. We've seen people.
Black stone.
Oh, yes. They think that the snake, even the bleeding, where the vein bleeding is where the black stone stays. They've seen several of them. So if you put on lead, there's no environmentation, you will see that it doesn't work. I grew up in the village myself. So these are things we are saying both academic and local street knowledge. We know that this is how this is happen. But we can do a lot to prevent the snake bite and to help the person, the victims of snake bite. That one, there is no argument about it.
No argument about it. So, for emphasis sake, now, when a snake bite happens, what should be the first and immediate action to take? And if we are to quantify according to duration, for how long are we expected to, keep someone who has been bitten by a snake to say, okay, we are giving him preventive or we are giving him some form of first aid before rushing that person to the hospital?
As soon as the person is bitten, because take the pen to the way I cannot give duration, but as soon, because like those ones we saw, where they came, some of them are about 3 hours, so far 4 hours. So I can't compare with somebody that's beaten in local yes, and don't mind that some of them they came after 2 days. Like I told the Babalawo, we chop in own, the nurse will chop, the person in the village will chop their own there. When they see it's going to now bleeding from nose, one of them will transfuse up to 5 pints of blood because they've been bleeding because already paper white. And some of them, the antivenom, maybe you just need 2 or 3 antivenom. Now then we see them taking 6, and the thing that they are expensive. The correct one, there is about 360,000.
Oh my gracious God.
And there are some, you see, they will get 120, 170, 250, but the one that fairly good will be given to 350,000. And some may need 2, 3, 4. That's over 1 million already.
1 million.
But if you come at that time, what do you need to? So these are the things. As soon as you come, take to the person to the hospital. So, and the person will have a better. So, we cannot give a say duration that is 3 hours because where the people come from here, it differs from one person to the other. But the right thing, as soon as it happens, take to say all these delay, go there. That's all part of the problem why people now have morbidity, because the effect of snake bite, the effects go beyond that one that even the person survives. So it goes beyond that time. So that's why that even somebody having snake bite, the person can come down with kidney failures for a few years. So it's not that you have treated the thing, the Baba treated the thing. No. So that's why we are saying this, and it's common. That I can see now virtually everyone there. They had about have idea of what to be supposed to be.
What to do when it happens, and the ideas are not actually ideas that are very relatable to the present time that we are. I have came across someone who was bitten by a snake. I learned he was bitten like last year, and the year I saw him, his skin was peeling. So they said from time to time, his skin peels. You know, so apart from that kind of consequences, what are other consequences that happen as a result of snake bite that was not properly treated?
Actually, immediately that snake bite happens, part of the thing, like I said, there may be bleeding, swelling, some may become anemic there. Some may even have problems with cobra and have a problem with eyes. And have problem with their eyes. But one of the key areas is the kidney problem. Some the wound, you will see the place we call it necrosis. They will peel off and we see as if fire burns that person there. Yeah. Some may have to go for surgery, more go for debridement. These are part, and stroke can also cause stroke. The snake, that can have stroke. So it can have defect, can what we call arrhythmias on the heart. The heart not beating very well. The normal breathing of the heart becomes abnormal, and heart can stop breathing immediately. It can cause what we call pulmonary edema. The fluid accumulates in the person's lungs. The person will not be able to breathe very well. So, and people will not even know that they're supposed to take. They will still think before. So, this is after some days. So, but even the long time is what we are talking about. That can even cause different kidney problems, come and become anemic, and some may need to amputate the leg or the hand. This is even apart from the person may not be able to do the normal work. Is doing job loss, even the limb loss, and even the source of revenue will be lost, burden or where to get socio-economic problem coming there because some may not be able to do their normal work. For example, during dry season, a rainy season is coming. Some is their family that they live on the farm. So the money is bringing money. You can know the which means next year. Then be prepared. That's where the problem will be. We will now see the problem because there's nothing to no farm this year. So it goes beyond even just treating that person.
Thank you so much, Dr. Adebayo. And you know, for a very long time, our Nigerians already have these acceptable norms in their head. That yes, we have practices that we believe have been working because it has worked in the past. Going back to the issue of cutting, the sucking of the venom, the tying of the leg, some will still argue that these practices are still working. If you are seeing them presently, looking at you on the screen, what would you tell them on how unsafe such practices are?
That we will still continue. Apart from my field, I'm also a public health physician. So where we go out to tell people, we don't even want them to come down. If not, we'll have set up. Maybe we should try one poisonous snake. So give you a bite very well, so that you go and meet those people to treat you. And so that, but since we don't even want the person, anyone to suffer the thing, I will beg that please, prevention is better than cure. And to continue to educate our people. You know, some people who have lived with all those for a long time. It's difficult for them, for people to come out from such wrong notions because they grew up with it. I told them, it's very likely there's no envenomation because it's not every time a venomous snake bites that there's envenomation. So that's often what people think as if it's being treated. We have seen, you can even come to the hospital and we will tell you there's no envenomation. So we will not, because of that, go and give you anti-snake venom. No. But when there are envenomation, you will see. There are 30 signs you will see. When we usually collect their blood and put it and check. If it doesn't clot, we call it whole blood clotting time. Best whole blood clotting time. Usually it should be within the 10 minutes, 12 minutes. But after 20 minutes, if it's not clotting, that's a sign. That's one of the signs. Before the person even start developing some, even if the thing is not clot, it's not clot, we will still wait and check again. So I will beg the person that will not be able to just tell him or her that please don't try it. And if the person is free, we can have one of them that are having snake bite and let them to come out. So come and beside time, where things work at time, you bring people to see what people are going through it through. So you will know you need to preach. You don't need to preach too much for them to understand that this thing is actually real.
You know, one of the major setback, I believe, for most people, once such happen, they think about the cost implication. So what are the likely treatment options available in our hospitals, and how effective are these treatment options?
Yeah, the thing I realized the other time, we come to the hospital, we know, we give the person, because some, they can have tetanus.
Immediately.
Can have infection. Apart from the snake bite, they carry infection again. And that will be becoming problem, infection in their blood. We take care of all this. Then if the person is now having evidence of envenomation, that is the venom, the poison has entered the person, we give the person anti-snake, anti-venom. What we give, usually the standard dose, usually we give one. After we're supposed to give, you see standard dose 2, 3, which is to be given 6 hourly.
6 hours.
Yes, but some we give one today. Person gets the money to buy another one tomorrow. The person that is collecting 60,000 or 50,000 and he's going to buy something of 250,000 and it's not even working. And the other those ones are not working so much. But in the hospital, we give this antivenom, and then depending on if it's bleeding much, we can transfuse. There's what we call in children, we call exchange blood transfusion. We take the person's blood out and then give the new one. This is just to dilute and reduce the venom of the blood. A vial of snake bite is just 10 ml. Usually you need about 4 initially, and you may need to be doing it 6 hourly. So that's what we do in the hospital. Then depending on the other complication that sets in, any complication that sets in, we treat, because you cannot determine what the type of complication the person is going to come up with. So irrespective of the complication, we treat. There are some we don't give blood transfusion, but like one of those people, we gave 5. We gave 5 fresh whole blood before we discharge her last week. There are some we give them 2. Some we give them 3. Some we don't give it, just anti-snake venom. Yes.
Okay. One of our major target here is prevention. How can individuals and families prevent snake bites around their environment?
Yeah, like whether prevention is better than cure, and I'm very, very happy with that prevention. Now, what you can prevent infection is start from yourself, and by also knowing that is snake bite. Snakes, venomous snake, they are in our environment very, very well, especially in Kogi, though I'm most part of the country, especially northern Nigeria. So keep your environment clean. Don't walk barefoot. If you are going to work, especially that we are coming to standard, work with standard. You can wear basic farmers, wear boots. If you keep, there is anti-snake that you can spray in around you. I just sprayed my place last week. And also those who are there are some leaves like tobacco and some. I learned when you plant them, because of the scent, because of the odor, that those odor pursue snakes. They don't like it, so I don't see it. They don't like to come near. So, and I've seen that for quite some time. It also the odor, the scent from them, chase snakes away. And also, if you know you are rearing poultry, this is another thing to have to also be careful and keep that environment clean and use this anti-snake around the place. And don't use hand to carry snake. Don't put hand inside the hole. These are common, that is being sensible prevention, but we wonder why somebody, because people have been doing and they've been going scot, so they didn't know, so it's difficult until they are now beaten. So don't pursue snake. So, and even a dead snake is still dangerous. Even the dead snake can still, the venom can still affect anyone as if it's beaten fresh. So, and the snake charmers, that's another we want them. Don't play with snake. Don't play with snake. It's a common adage we wise in our area that the snake charmer usually die of snake bite. Most of them is snake bite that usually kill them. So these are common preventive conditions. In your house, like don't let it be bushy. If you have parked tiles, wood beside your house, go and take care of them. You and take care of them. Take them away from you. and don't allow it to be bushy. And then make sure that every part of your house is lit. If you do this very well, it's very unlikely. If you are working in the night, use flash torch. Don't just think that nothing will happen. Or we are working in the night with slippers. These are common preventive measures we can take.
All right, thank you so much. Dr. Adebayo, glad you are still here on the program, Health Hub 360. We have been talking about snake bites, prevention, first response especially, and then treatment options available. Our lines are now laid open for you to call and send your question through the short medium service. You can send your comments and contributions via the number 090702459. Let's take it again, 09070245924. Thank you so much for being there. We're going to take a short break. When we return, please feel free to call. We already have some questions here, like 2, but we expect to receive your call soon. Thank you for being there.
For decades, we have been your trusted window to the world, giving you 360 coverage from Kogi State, Nigeria, and beyond. Now, we are taking it even further, uncovering stories that others overlook, bringing fresh perspectives and giving voice to our communities. From the 21 local government areas of Kogi State to the heartbeat of our nation and the pulse of the globe. We dig deep into the environment, education, politics, commerce, culture, sports, and every issue that shapes our lives. It is more than headlines. It is insights. It's in-depth. It's new wave that keeps you informed, inspired, and ahead. Join us live every Saturday, 7 to 7:30 p.m. on your national television, the Nigerian Television Authority, Lokoja. Weekend Panorama. News redefined. Stories that matter. Just for you. Welcome to Health Talk 360, where your health meets the bigger picture. Every week, we go beyond the symptoms and headlines to bring to you the complete features on the issues that matter to your well-being, from nutrition to mental health, maternal and child care to chronic diseases, fitness trends to breakthrough innovations. We cover it all with clarity, depth, and trusted experts. Our mission is simple: to give you practical knowledge, real solutions, and inspiring stories that help you live healthier, stronger, and smarter. It's not just a program, it is your complete guide to a better life. Your 360-degree view of health. Join us live every Tuesday on the Nigerian Television Authority, Lokoja, for Health Talk 360. Informative, engaging, and life-changing.
Glad to have you back on the program, Health Talk 360. Doctor, thank you always for choosing to be with us. There is this usual belief that they said children and snake are friends. I don't know how true that is. Are children also vulnerable to snake bites?
Very much.
And if yes, what are the precautions that parents can take to protect their children?
One of the people called at risk when it comes to snake bite, one of the groups is the children. The children, when they are at risk, because usually they will be calling it a rope and be chasing the rope and be following the rope. The snake will not say, okay, since you like following me, what I have, make I give you. And that's where so they will start crying. And the people pour another set where you have negative complications that usually develop more than the children, because the volume is small. So the volume is, the snake does not respect you whether you are adult or small. What you will give elderly person, what we give a small child. So that's why the effect could be very grievous in children. So they are not friends. So and because the complication in them is usually very grievous. And that's why even the dose, when we are treating them, what we give to adults is the same dose we give to children.
The same dose.
There's no disparity in term of dose. So they are one of the vulnerable groups.
Vulnerable groups.
Yes.
That affirms it. There is a story of one old woman I learned who saw just a very tiny snake walking by. So what she did, because the snake is very tiny, she decided to pick broomstick and, like, unknown to her, okay, while she was trying to, like, okay, let me hit it, just a broomstick, because it's very tiny. So later at night, her leg got swollen. So she was wondering what could it be. So she just used the balm, rubbed the place, and just forgot about it. Few minutes after, it turned into something different. This is a family I know very well. An old woman died as a result of that tiny snake. So does it mean that snake don't matter? Their sizes don't matter?
Most of those venomous ones, the size doesn't matter, is the content. But especially most of those venomous ones, they are even small. Like the viper, you can see how small it is. Adder, small, may not be more than this, but it's very dangerous.
Died.
And if it is elderly person again, you know, I told you extreme of life, they are part of the grievous. If it is 40, 30, they can say, but if there are those people that came, if they were elderly people, if you mess around with your time with an elderly person or a young person, you are not likely to save that person. So the size does not matter, it's the content. And the season also is another factor. If one is beaten during the dry season, the snake, small venom is concentrated.
Okay.
You know, they don't have enough water to drink. Unlike in the rainy season, they have water, so a lot volume of this gland with a small. But in the dry season, the small is very concentrated. So it's worse even like that.
It's worse during dry season.
Yes, ma'am.
And the sizes don't actually matter.
Yes, ma'am.
So don't joke with them next time you see them. We have this question which is coming from Musa from Kabawa. He says, Doctor, some people say if a snake bite does not pain much, it is not dangerous. Is this true? Thank you so much, Musa.
It is not true. Because snake bite, like I said earlier, the effect you may not even see it immediately. But one of the things you see from snake bite, you see the place may be reddened, you may have pain there. It may be bleeding, it may not, but the pain may not even start immediately in some. So it is later you will now be seeing sign of pain, now be swollen. So it is not until you wait for pain to come. So if you either and there are some but usually if you see fang size, you are seeing the teeth on it, and many. Usually in medicine we say it's very unlikely to be poisonous. But don't try that at home. Bring the patient to the hospital. So pain is not a yardstick. If you don't have pain, it may just be initial when there is no pain. There are many that are responsible for pain in somebody with snake bite. Take the person to the hospital for appropriate management, assessment and management.
Okay. Sometimes, does it really matter? Is it in all cases that we have that punctured sign of either tooth, fungal, or sometimes we may not have those signs?
Yeah, I said that if you may know one of the another poor prognostic index is for you not to see anything at all. So you will think there is nothing. And sit down at home. And most of the poisonous ones, you usually see one or two. Though occasionally those who may see more than that in the poisonous or in the venomous one, for the ones in snake at times. But commonly, I'm talking about the common sense. So and I said also that we don't use that one to differentiate snake. It's when the person comes, we assess him or her and then place him or her where the person belongs to in time of management. So it is not even the fangs, but commonly the venomous one usually may see 2, 1, 3 fangs.
Okay, we have a question from our social media fans. Say, Doctor, how do we keep snakes away from our homes? Thank you so much for that question.
We can keep them by keeping our environment tidy. I mentioned some of the things, flowers we can even plant around ourselves that also they chase. Try this because of the scent they reproduce, chase them away. And we can also use chemical. There is a snake we can put in our environment which kill. There are different brands that can kill snake, and things that we know that can attract, let's do away with them. In time of, maybe if you keep poultry, keep it very clean. Some people even because of, yes, some people because when they are having something that do with snake, they also look for something that can kill snake and rear them to get rear them. For example, now pig, you see, you just take snake and be eating as if it's eating, and there's nothing the snake can do to pig. Even
I also heard of cats.
So these are things that usually you do them and keep them. Don't walk without your shoe. Especially in this time you are walking in the night. Walk with a flashlight and also walk with a boot. If you are going to farm, walk with a boot. Go and look for boot and wear. And if we do this thing, usually the degree of snake by the prevalence will go down. The incidence will go down.
We have another question coming from Blessing from Filili. She said, Doctor, if someone is bitten by a snake at night and the nearest hospital is far away, what should we do immediately before help arrives?
Thank you. As soon as you know this business, keep the place straight. Don't make any mark on it. Don't tie it. Don't use it to walk as if you want to show that you are strong. The more you walk, it moves a muscular contraction. It will make it to go to your heart, and that will come to the body. So just keep it straight. Take it, even if you are 2 hours, do it like that, and then carry the person to the hospital, straight to the hospital. So it is those delays, and let's go and see this one. By the time they now find that this person is living, that's where you have big problem when they come to the hospital.
Okay, thank you so much, Blessing. And we have Abdullahi from Sarkinoma, Lokoja. He says, what simple things can families do at home to prevent snakes from coming into their environment? Thank you so much, Abdullah.
Okay, thank you. It's a simple thing you can do is keep the place clean. Keep the place clean. Say will not keep your environment clean. Walk and then keep the things that you know can attract, keep them away from you. Fleet your place. Somebody has even the one we used to create herb, to kill herbs, to create grass. There are people who mix the thing together. They are using it for you if you want to kill snake. They mix it, they want to help. And the thing is doing 2 in 1. And when you do this, it's not likely you have snake invading your environment. And when you do it, even including inside the block cement or your fence, put the venom, put the chemical in it, and you will see, you will not see them there.
Okay. We have another question, possibly the last question we're going to take. If a child is playing outside and gets bitten by a snake, what are the first steps a parent or guardian should take?
It's the same thing with the adult. Take the person to don't cut the area. Don't be putting alcohol. Just keep the people and those scared, just calm them down. But you that want to help, look at that area so that you won't be two victims at the same time. So keep the person and take the person to where the person appropriately where can get. So that in case there's envenomation, the person can be managed and the person will reduce even the number, the cost, and the burden and the problem you are going to find. It can be reduced. So take the person to the hospital.
Thank you so much, Dr. Joseph, and thank you too for watching the program Health Talk 360. Before we say goodbye, Doctor, let's have your final word, especially to the public on how to stay safe from snake bite and how to correctly give first responses in cases where there is snake bite emergencies.
I want to appeal to our people and tell them that snake bite is real. And the consequences can be very, very devastating. From limb loss, heart failure, and renal failure, and some death. So please, that's what I want to do. And it's also highly preventable. So if you see the snake bite, what you do, or somebody around you, take care of it, please. Carry the length in the place gently. Take the person to where you will receive treatment. And if you keep your environment clean, you can use chemical to scare them away. There are some herbs you can plant and we land, and which I have in my place also, that can scare them away. So please do that, and you are very unlikely to see snake bite.
Thank you always, Dr. Adebayo, and special thank you to audience for taking your time to be with us throughout this program. It has been quite educational, no doubt. Snake bites usually happen suddenly, but I believe the outcome doesn't need to be tragic. The right information, knowledge, especially on how to respond when it happens, we can help save lives and keep ourselves healthier and safe from these creatures. They are tiny. Sometimes people say they are beautiful, but they are indeed dangerous. Keep our homes clean, our environment clean, and let's protect our children, especially because they are among the most vulnerable population. Until we meet again in another interesting edition of the program, Health Talk 360. I say a very big thank you to the crew who made this program a success. And at the same time, I want to also remind you to stay alert. Take preventive information. Very, very important, because awareness is not just information. It is indeed protection. See you next week.
If clothes or outfit